Hello, everyone. This is Dr. Paul Magarelli from CNY Fertility. It's my weekly In Search of the Stork broadcast. This week, it's an extended In Search of the Stork. It was a request from our patients. CNY Fertility is live now, so there it is, all things male. So if anybody's out there on the stream here, please say hi. Looks like we got 16 people, more or less. We got one saying hi. My name is Dr. Paul Magarelli. This week we're going to be, hey Jennifer, good to see you. Hi Annette. Hello, my mom and I will be in. Love it. I love families. It's really important. Caitlin, hello from Wisconsin. Tanya, hello. Good to see you, my dear. As you know, this was the most requested topic for me, which was male factor infertility. It is going to be going for about an hour and a half. Hi, Amber. Anxiously awaiting my beta. Okay, so are we. Gertha, good to see you. Fiona, good to see you. Nefertiti. Hello, Nefertiti. Where are you from? Stephanie King. I know who Stephanie King is. Stephanie King is our wonderful acupuncturist that works with our CNY fertility patients, and Dr. Diane Credenda at East Winds Acupuncture here in Colorado Springs. Hey, Mimi, good to see you. Jenna Lee, good to see you, or see your name, I guess is what I'm really saying. Hey, Atlanta. Oh, Nefertiti, I just had a wonderful dinner with Dr. Verdialis out of our Atlanta office. What a wonderful lady. We spent the whole day working here in my clinic, and then we went out for a wonderful steak dinner, and that girl can eat a good steak dinner, no question about it. Anyone on our Instagram, folks, jump over to Facebook Live today. It's going to be quite a long discussion on all things male. It's going to be kind of fun. Oh yes, Nefertita will say a prayer for you on your beta. She is wonderful. I agree. Hey, Jasaman, my dear friend. Dr. Banerjee, he's one of our wonderful CNY doctors. He will be here in Colorado Springs, helping me have an opportunity to go see my mom. I'm going to spend 4 days going to see my mom out in Scottsdale, and he's going to be helping me here, as well as, of course, taking care of my wonderful patients and staff. And hopefully I'll get him to cook, because he's an amazing cook. Hey, Gertha, Long Island, good to see you. Let's see, where are we at? We are accumulating. Amber, Stephanie, just got my acupuncture scheduled here in Kentucky. Oh, great. I'm glad, Amber, you appreciated Stephanie. She's an amazing gal. We had we're working on a new website for East Winds Acupuncture. And so we're going to integrate it better with CNY Fertility. So you'll see a lot more integration. Our family is growing. That's all I can say is that the CNY Fertility family is absolutely growing. And we are so blessed by all of your support. We know how much you enjoy these lives. I know Dr. Kiltz does many. Dr. Verdialis does it bilingual, by the way, a wonderful one. And we have many different topics, and all of them are geared towards making you more powerful consumers, so that you can be better patients and have a much better outcome. Hey, Julie, it's good to see you. Again, thanks for jumping on. I will be. I have quite a few slides to go over with you. Remember, this was all for men, so you guys all promised that your husbands are all going to be online, your boyfriends, your husbands, your lovers, the fathers of your next children. Remember, this was for them, so you were supposed to bring them all on, and I spent quite a few hours, I'll be honest with you, trying to put together a cross-section of everything we know about male factor infertility. It's somewhat technical, somewhat untechnical, so it's going to be a pleasant mix of information. Hey, Allison, good to see you. Okay, thank you, Tanya. Hello, husband. Thank you for being on. Eddie, thank you. Matt's here. Hey, great. This is great. Fabulous. I did this for you guys. Yes, we're going to be talking about sex, so it's probably going to worth listening to. So we will definitely be do that. Hey, Richie, good to see you. Hey, Nicole, good to see you. Um, and again, the more we partner with our partners in creating one healthy baby, it really makes it the journey better. Um, there's Stephanie. Okay, and then Nicole. Hi, Nicole. Good to see you. So if anybody jumps on Instagram, understand that we're doing because of the way StreamYard works, we can stream to YouTube, we can stream to Facebook, but we can't yet stream to Instagram. So um, it is what it is. So I can't show you slides on Instagram, but boy, can we do a lot of stuff on our streaming platform. Hey, Luigi, thank you for being here. We'll have lots of interesting stuff that you'll have some fun with. I want to see if we can break the internet today. I'm hoping for over 100 folks to jump on. We've got over 55 so far, and that's only in the first few minutes here. So I'm just kind of stalling for a little bit more time because once I get started, we've got about, oh my gosh, probably 90 slides to go through. Some of them are short, some of them can be long. Now, I'm not going to take a lot of questions unless they're really like hit the nail on the head with regards to male factor infertility, because this is really for the guys. This is for them to sort of hear a lot of the stuff that you women know, been part of, you've been reading, and and again, a lot of the time, healthcare is left to the woman. Unfortunately, in the area of fertility, healthcare or fertility is really a 50-50 proposition. So I'm going to talk about a lot of things. Oh, good, Christy. 2 views. That's right. Thank you. So I do have 100 people because everybody's got their partner with them. So I can get started. let me get my slide ready here. Let me get my pointer ready. And oh, by the way, yeah, you guys can see my pointer. I'm gonna get a laser, so it looks kind of cool. So let's talk. Let's do some fun facts about with the area of fertility. It's a 50-50 role. Typically, in a untested population, 50% of infertility is the male, 50% is the female. Actually, it's 40-40-20. What do I mean by that? It's 40% female exclusively, 40% male exclusively, 20% male and female. So therefore, it's a 50-50 deal. But here's the interesting thing. The moment you guys come to my office, any doctor's office, any fertility practice office, to ask the question why we're not getting pregnant, it shifts to about a 70% male factor, 30% female factor. And the reason for that is that the OBGYNs tend to take care of most easy cases of fertility, female fertility. And so the tougher cases end up coming to us, and about 70% of the time, those tougher cases are essentially a male factor. So males play a huge role. And here's the other interesting fact. 50% of miscarriages are caused by something in the male's lifestyle. Smoking, drugs, alcohol, exposure to pesticides, herbicides, phthalates in the environment, poor nutrition, obesity, lots of things that we have some control on. And it's only recently we're beginning to understand that miscarriage in your partner, your female partner, could be caused by the fact that you smoke or have you're carrying around extra weight or drugs or so the purpose there is to affix the dual responsibility between the two of you in terms of who does what to whom. And it's really, you're a couple, you love each other, you want a baby, and we're doing this together. So healthy body, fertile body on the male part, healthy body, fertile body on the female part, and working together. And I'm going to talk a little bit about togetherness down the road. So again, typically it's 50-50, as a 50% cause of infertility is the male. But once you come to reproductive endocrinologist, by then it's about a 70% chance that there's a male factor. And there may be female factors, but it begins to predominate. So you guys play a huge role. Now, again, in some of these slides, there's a lot of detail. And I'm going to sort of make it easier by describing them. So what about a simple thing like sleep? So if the average is about 8.5 hours, if you undersleep, your sperm volume goes down. If you oversleep, your sperm volume goes down. So there is an optimal time. So too much, too little is not good. Similarly, but not as directly in terms of motility, not the total sleep, but the total night sleep. So this is sleep meaning naps through the day. This is night sleep. You can see if you have fewer and fewer hours of night sleep, this is hours slept, like 4 hours, 6 hours, 8 hours, there is much lower motility in the total motile count in the sperm. Similarly, if you oversleep more than 12 hours, you're going to see the same effect. So the bottom line, something as simple as sleep may improve fertility, and that in turn is something easily fixable. So just again, these are little vignettes of information. It's not a full-fledged lecture, but it gives you something to think about. Here's a sorrowful tale, and this tale is now being corroborated, and it continues. This was a study looking at 50 years of semen analysis sperm counts from 1930 to 1990, and these are the average sperm counts. These were done in like semen analyses that were done in sperm banks, that sort of thing. So they're pretty good, strong numbers of broad populations of folks. But if you look at this, you can see that as time has gone by, the average sperm count has dramatically dropped from about 120 million down to about 50 million. And this was, when this came out, it really became somewhat of a panic. And a lot of studies went out and they said, well, maybe this is not true, this is not true. Well, then they repeated the study, and this is from 1970 to 2010. And again, and this is much more data. This is much more data that has been collected from around the world. And what we're finding is we are continuing down this slippery slope of lowered semen analyses in terms of total sperm concentration, total sperm count. And if you look at the sort of the mathematics of it, we're seeing about a 50% decline up to 2010. So what's happening in the world is and it has to do with nutrition, it has to do with exposure to pesticides, herbicides, has to do with lifestyle. All of these have impacts on outcomes. So, and I know there are many people who eat organic, stay away from plastics, get away from BPAs, better lifestyle. These are real. These are real changes that we're seeing in our population, some controlled, some not. And then so their conclusion in that study was that there's a significant decline in North America, Europe, and Australia, because that was the study population, of 50 to 60% decline unselected by fertility. So these are just the guys walking in the street. These are not semen analyses of guys coming in. This is basically looking at a population of people who are willing to donate sperm, basically. And what they found is there's no leveling off. This decline is serious and it's continuous. So changing lifestyle, which I'm going to show you, has a huge impact on outcomes, is going to be critical for you in terms of helping your partner achieve a pregnancy. And in the old days, they used to be called, in the 30s, super males. You know, these are males who average 100, 200 million, 300 million, 400 million, 500 million sperm. They've all but disappeared. These supermen, as I call them just for fun, now in 1981, what used to be in this 100 to 200 to 300, 400 million folks are now in the 20 to 40 million. That's what this little square is. So there is an effect that's outside you. However, you can't change all of that, but you can reduce your exposure to toxic chemicals, both lifestyle chemicals and non-lifestyle chemicals, and we're going to go over that. Another thing that I've been asked many times is, well, does abstinence help you with your sperm in terms of a sperm collection for a semen analysis, or sperm for use in an IVF cycle, or sperm for use in an IUI cycle, or even sperm that's being used for timed intercourse. So basically, we call it homework. So what we see is that there is a benefit to at least 24, but in most times, 3 to 5 days of abstinence prior to providing a sample will allow you guys to give us the best average sperm population that you can give us. And that's what we're looking for in terms of the testing. Now, in terms of intercourse, I'm going to talk about how often you should have intercourse to have a baby, etc. But this, I thought, was a nice reminder that a little bit of abstinence when you're providing a sample is going to be critical. What about things that we have a little bit of control of, like an overweight and obesity in males? Does that seem to impact? Because one of the things that has changed since 1930s, and certainly since 1970s, is we have an obesity epidemic. We are, as a nation, as a world, simply getting heavier and heavier and heavier. And is that going to impact? Well, the answer is absolutely. The addition of fat plays two roles. One, it secretes estrogen, which shuts off testosterone or lowers your testosterone, which means your libido is impacted. And it actually has a pathologic effect on the amount of sperm you make and the amount of azoospermia, which means no sperm in a semen analysis, or oligospermia. So the man's weight has an effect, and I put together a few slides here. And this is looking at BMI. And so this is the, we'll call it, used to be the average male BMI is around 20. That was in 1930s. The average waist size for a man was 26 inches. You know, by 1970, the average waist size was probably around 28, 29 inches. Today's average waist size is around 44 inches. So a 20 BMI person is probably 5'10", weighs 140, maybe 150 pounds. If you're 5'10" and you weigh 180 pounds, you're now considered in the obese range, around 30. And if you're 5'10", weigh 250 pounds, and of course you're in the obese range. And so what it's showing here is the odds of conception. This is natural conception, intercourse, declines dramatically as we add BMI, or waist fat. So the fat around your waist really is an issue when it comes to the impact on fertility. So fitness is absolutely something that we think of in terms of the male and the dominant male, the alpha male, but it's also critical for sperm production. So in this natural conception model, even a slight increase, a BMI of 22 is like 100, maybe 155 pounds, 5'10", right? Maybe 160 pounds. So you can see that just the addition of weight, which increases your BMI, because you're not going to change your height, of course, results in greater and greater risk of infertility in your partners. Now, but what about other things, other lifestyle things? Well, it turns out, of course, and these are small, and I don't intend for you to read them, but basically this is looking at the age between 30 and 70. And this is the total, the volume of sperm, the volume at which you ejaculate. You can see that there's sort of it begins to decline rapidly over about 55. The more caffeine you drink, the lower the sperm volume, the more days of abstinence. We talked about this. The better the sperm sample. There's a perfect curve here for 8 hours sleep, but if you go too much sleep, that's a problem. Too little sleep, that's a problem. In terms of count, as you get age from 20 to 60, you see a dramatic decline in the amount of sperm that you ejaculate. And then similarly with motility, you see this dramatic decline. And total motile count, which is simply a collection of how much sperm, again, this dramatic decline. And all of these things that you can do, which are caffeine, days of abstinence, and sleep, these are things that you can adjust in terms of improving your reproductive capacity by reducing the amount of caffeine, I don't recommend you gals getting a younger husband. That's not the purpose of tonight's talk. Days of abstinence between. I'll talk about how many days between intercourse you should have when you're doing homework trying to get pregnant, and of course improving your sleep patterns. It's been shown to help in all kinds of things. Now, what are some of the habits that have been shown to negatively impact fertility? Thanks for the laugh, Nefertiti. So the natural odds of smoking, I'm showing you women first, and then, by the way, I'm not going to be answering any questions for about at least a half an hour to 45 minutes. So don't forget to ask them back, okay? Because I have so much to cover today, and that's what I promised to do. So your relative odds in a female smoking goes down 60% if you're a female smoker. And you can see that's both for natural fertility and IVF. It goes down about 50% if the female smokes. But guess what? When the male smokes, look at that dramatic decline in the chance of IVF pregnancies when males smoke. So you're kind of saying, well, how the hell is that? I mean, they're not carrying the baby. They don't have an egg. Well, it turns out that changes, we'll talk about a DNA fragmentation, changes in the DNA seriously affect the ability in intercourse for patients to achieve for couples to achieve a pregnancy. So even with ICSI, and I'll tell you about that, how we put the sperm inside the egg, smoking significantly impacts fertility in your wife. There's no question about it. Coffee for females, there's equivocal discussion with females. I think the American College of OBGYN says that it does increase your risk for miscarriages. There's another bigger study that's saying that this is for females, that's what the female symbol is there for, so you know there's the female symbol here. So that tells you that yes, coffee affects females, but if you look at miscarriage rates in females of husbands who drink a lot of coffee, right, more than 2 drinks a day, there's almost a 2-fold increase in miscarriage rates. So coffee in men is not necessarily a positive thing for the men and a negative thing for the women. Too much of anything is bad, but in this case, it's showing us that even caffeine consumption can have a dramatic impact on miscarriage rates, not pregnancy rates. So, and it's showing you the amount of caffeine does make a difference. So under 2 cups, no problem with live birth rates. But boy, once you start getting to 3, 4, 5, 6, 7, 8, 9 cups a day, the actual live birth rates dramatically decline if the male is drinking extra caffeinated beverages. And it's not just coffee, of course. And then what about alcohol? This is for females. We always tell our folks, females especially, because of things like fetal alcohol syndrome, and because, and we'll talk later about the fact that women's eggs are always in their body. They don't make eggs. They simply have them, and they lose about 1,000 a month. Even though, so for females, drinking excessive amounts of alcohol plays a huge role in natural conception. Again, this is another study showing you that 1 drink or less may not raise the risk of anovulatory infertility, but that does not mean positive reproductive outcomes. What about, oh gosh, I didn't get that. I'm sorry. In males, it takes, I'm sorry about that. In the males, maybe that was the males. Hang on a second. On the alcohol. No, this is female. I'm sorry, I didn't get that male one in there. In males, it's the same thing. Moderate doses of alcohol in a week are not so bad, but what is moderate doses? 1 or 2 drinks a week. But once you start getting into excessive amounts of alcohol, 2 or 3 drinks a night, you do see a marked reduction in reproductive outcomes. So I'm going to just turn back Instagram here. It looks like it's shut off here. Let's put that back live there. So hi, folks on the Instagram. Come over to CNY Fertility live Facebook page, because that's where we're doing our talk today. What about your exposure and the kind of work you do, working on oil fields? Well, again, what they found was that the impact of exposure to hydrocarbons in your job can have a negative impact on the shape of the sperm. That's called morphology. That's what its little arrow up top here is showing, is that morphology shape, like here they're all normal, here they have two heads, two tails, that kind of thing. But in this study, and actually this is our new embryologist, Caitlin Schellenberger is our new embryologist. She showed me her studies today, so I quickly put it up here for you guys. But she did a study looking at hydrocarbons and about men looking for fertility care, and they found a significantly lower normal sperm shape in those men who were exposed. So I can tell you, I'm going to talk a little bit about occupations. Again, some of these are controllable, by lifestyle, by how you manage yourself. Some you're not. You have to work, and if you're exposed in this area, cleaning after is important. Then I just kind of thought it would be interesting to see the proportion of infertility cases that are due to male factor. As you can see here in the world, in North America, it's a 50-50, 50% of infertility is the male. South America, 52%, but you can see in sub-Saharan Africa, it's only about 20 or 40%. Middle East, it's about 70%. In Asia, it's about 40%. Australia, about 40%. Europe, about 50%. So it does have a distribution. Again, part of my purpose today is to tell you all things about the male, and some are going to be technically related to fertility, and those are just fun facts. Oh, here it is. Okay, this is female intake. So drinking alcohol and the odds of success if you do drink alcohol for a female. Again, this is not a very good slide. I should have made it bigger, but you can see there's a dramatic decline in your chances for IVF success when you drink. So if you drank a year ago, no big deal. But if you drank a month ago, or you drank a week before your IVF, you can see a dramatic decline in IVF success. Here you see, this is the man. So this is where I was telling you that the number of drinks, anywhere from 1 to 20, which is about 2 a night, somewhat steady with some variation. If it's greater than that, you see a dramatic decline. I don't suggest you do up to 20. I'm just suggesting that there is a dose response curve, that the more you drink, the less likely you are to impregnate your wife, and less likely there's a chance, or there's more likely a chance that you're going to have lower sperm counts. So what are some of the things that people talk about helping? Well, in this slide from a buddy of mine, Dr. Axelrod, he listed L-arginine, L-carnitine, CoQ10, vitamin C, vitamin E, inositol, chromium, zinc, flavonoids, beta-cytosterol. I'll add to that folic acid. And then, of course, there are many studies, and I'm going to go through them quickly, showing that acupuncture. Now, if you've listened to my talks before, we talk a lot about the female and acupuncture and how it helps. So this was kind of my first deep dive. How does acupuncture help the male? And does it help? First, the question is, does it help the male in terms of improving reproductive outcomes? So in a variety of studies, and I'll go through those studies, this was a study looking at the impact of acupuncture on the odds of sperm concentration going up or going down. And what they found, so if you're on this side of the curve, this is called a meta-analysis. It's an analysis of analyses. And I'll just look at this one here. You take a variety of studies and other studies, and what they found was there is, with the use of acupuncture, there was almost a 9-fold improvement in sperm concentration and motility with those who had acupuncture. So in this study, they found that adding acupuncture to the therapy for the infertile couple actually improved the concentration as well as the motility significantly in these studies. So there is an impact of acupuncture on motility and on pregnancy outcomes. These are pregnancy outcomes here. This is motility here, showing a causal effect. So acupuncture was shown. So it suggested that acupuncture in infertile men improves sperm motility, sperm concentrations, and pregnancy rates is insufficient from this meta-analysis here. This was just looking at sperm counts. And they found that, well, maybe we don't have enough data. So in this study, they were questioning the legitimacy, and then they said, okay, we need to do more studies. So when I'm going to talk to you today, I'll talk to you about the positives and the unknowns. And then there was another study looking at the shape of the sperm to determine whether or not acupuncture could change and improve the shape. Now, a sperm has a head, a neck, and a tail. You know, the head is where the DNA is. The neck is where all the energy is, the mitochondria, and the tail is how it whips around and goes forward. And this is electron microscopy of the sperm. And again, I'm not asking you to look at the actual numbers here. I'll just tell you that this last column is the column in which those folks got acupuncture. And these are ones who got fake acupuncture or no acupuncture. And in all cases, they found that there was an improvement in the ultrastructure, statistically significant improvement in the acrosome. Now, the acrosome is critical for getting inside the egg. This is where the enzyme is, this shape here. You can see a pointed head one here that's not functional. This rounded shape acrosome is functional. And what they found was with the addition of acupuncture, they actually saw structural changes in the shape or morphology of the sperm. And that is critical for that sperm to be able to fertilize a woman, fertilize an egg inside a woman to get through the zona pellucida. So they've actually shown that not only does it affect the concentration of sperm, acupuncture does, it affects the shape and the motility. So again, these are options. And then this is just a gigantic review of traditional Chinese medicine, which is herbal medicine. And what they found is that it was able to impact the hypothalamus pituitary testicular axis so that the hormones necessary for libido, the hormones necessary for sperm production can be regulated both with traditional Chinese medicine in the form of herbs. And here's a list of the herbs. I'm doing this for the acupuncturists online here. Anyone, by the way, who ever wants any of these papers, I always will have them available to you. And it actually was shown these herbs to affect oxidative stress. That is a key detriment to the function of sperm, is the oxidation, reactive oxygen species. These are the things that could definitely impact the function of the sperm. And what they found is traditional Chinese medicine in the form of herbs absolutely can play a huge impact on benefiting the reducing inflammation, preventing oxidative stress, reducing the DNA fragmentation index, and of course, modulating the loss of the sperm. So that's also important. And this was another study looking at the effects of traditional Chinese medicine. And what they, again, those who did the traditional Chinese medicine had a higher concentration, had slightly, well, actually statistically significantly better motility, and an unbelievable change in sperm shape. And as you know, folks, when we do semen analyses, the number one thing we see on our test is poor morphology. That's poor sperm shape. So here you see two very big studies looking at the impact of traditional Chinese medicine. So for all those folks out there interested in following up with fertility specialists who are acupuncturists, well, CNY certainly has the Healing Arts Center, very talented acupuncturist herbalists there. You could always seek out Dr. Diane Credenda, who's our integrative medicine manager. She's at East Winds Acupuncture here in Colorado, but she can help you around the world. And then also the American Board of Oriental Reproductive Medicine. The website is www.aborm.org. Again, my goal is for you guys to have tools to improve your sperm before we even get into the process of treatment. This is just again for my acupuncturists who are online. Here are the points in the acupuncture protocol that have been used to improve and the reference for it. So that's for you folks there. Again, here's another study. And what they found was that the sperm motility was significantly improved. The normal sperm, in other words, morphology, was improved. Fertilization rates, which is IVF, so this is in IVF, folks, was 66% versus 40% before the treatment, so a much higher fertilization rate. They didn't see any changes in the concentration or motility, and what they found statistically significantly better was the embryo quality. So sperm have a key role to play when it comes to fertilization and embryo quality that we never knew before. And now we're looking for tools that can help us. Here are some tools that can help us that are not very expensive. Again, here's another randomized controlled trial looking at acupuncture. And they found that there was a significant improvement in the percentage of motile sperm. So motility goes up, morphology goes up, not so much concentration, but that's a-okay because motility and morphology play a huge role. Here's even more data. In this one, again, it was these are the herbs that were used. They used acupuncture and moxa treatments, and those are the points that they use and moxa points that they use. And they found that they could improve the numbers of normal sperm with the use of moxa, with the use of acupuncture. Again, studies too numerous to count. This is one study in fertility and sterility. Acupuncture improves sperm motility. Another study, acupuncture improves testicular blood flow. We talk about blood flow for women, getting more eggs. Well, blood flow for men, getting more sperm. It's morphologically, the testicle and the ovary are analogous tissues. So blood flow plays a critical role, and they've shown that electrostim acupuncture will improve blood flow. What about sperm quality? Well, by quality, we look at motility, we look at morphology. Again, found to be true. Herbal formulas that can improve men with super low counts and low motility, it's called oligoacetozoospermia, and improve that too. So what can we do to help? Well, antioxidants we're going to jump now to antioxidants. These are things that you guys can buy, purchase. You know, vitamin E, vitamin C, carnitine, astaxanthin, which is good for the eyes, as well as an antioxidant, vitamin A, zinc, acetyl L-carnitine, selenium. Definitely take a look at the male formula, molecular fertility, on our CNY fertility site, because we're literally designing nutraceuticals to optimize the fertility potential, not just for the general health, but fertility potential. So this was a fabulous study looking at the effect of antioxidants on sperm parameters, and the improvement, this is sort of the red on top of the blue, shows you the improvement on the concentration, the motility, the morphology shape, all the shapes, pregnancy rates. You can see that there was a marked improvement when you added these antioxidants in terms of the treatment of the male. So again, something a guy can do. You can go to the store, go to a good store, get high quality nutraceuticals, add them to your diet. What about ginseng? Now, ginseng has been used as an aphrodisiac like forever. It's the big deal. It's the big kahuna. It's a root herb that's used in many different cultures. The American culture, the American Indian culture, Chinese culture, Korean culture. All of them have seen this as experientially has seen it improve reproductive outcomes or libido in men. And now they've been able to look at the actual derivation of its effects. So it does affect dopamine and GABA and acetylcholine signaling in the brain. It does affect the secretion of LH. Luteinizing hormone is what drives sex drive and sperm production. It enhances erections, again, probably from the testosterone. Sex hormones enhance erections, improve sperm count, improves the count and the quality. And it protects the testes from the traumas of life, essentially. So your traditional Chinese herbologist would be able to sit with you and say, okay, this is your constitution. This is something you can do. And ginseng is certainly something you can find. So I kind of been talking about sperm, but now I'd like to get a lot more specific. I'm calling it Biology 101, how we test the testicles, some of the treatments. We're going to talk about sex, of course. We're going to talk about the impact of sperm on miscarriages. And then let's not be afraid of a prick, gentlemen. Think about acupuncture. Remember prick with the needle? You can laugh. All right, let's look at our biology. Pretty straightforward. This is the testicle, very obvious. This is the epididymis. It's on top of the testicle. Here's your vas deferens. That's your plumbing that goes around the bladder, not through the bladder, around the bladder, and allows the sperm to travel to, this is the prostate, into the seminal vesicle. So now your sperm is stored there. Think of it as a waiting room. Here's the prostate. So when you urinate, the prostate opens this valve, closes this valve, and urine comes out. When you ejaculate, the prostate closes this valve, opens this valve, and then, of course, sperm comes out. You have a lot of glands. That's what makes up the semen. Thank you for the no pun intended, Jessica. No pun intended. These glands, of course, are responsible for that liquid. Semen is not sperm. So if your man ejaculates semen, it does not mean he has sperm. And you can't see sperm with your naked eye. You have to see it under a microscope. And then, of course, you could see that the penis, this is a flaccid penis, not erect. All of these are little compartments that get engorged with blood. And then you have an erection. And, of course, the urethra. If the male... so this has the prepuce around the, this is an uncircumcised male. A male that's circumcised will have the skin, the foreskin removed. That's just basic biology there. Comparatively, all of the functions that happen within the brain of the female in terms of regulating reproduction are the same ones that are happening in the brain of the male. There really isn't a difference. The goal, well, we call it follicle stimulating hormone, but in reality, follicle stimulating hormone is really gamete stimulating hormone. And so it produces in females, stimulates egg production. That same hormone in the male stimulates sperm production. Now, luteinizing hormone in the female is responsible for androgen production, and that in turn is responsible for estrogen production, and it's also responsible for ovulation. LH in the male is also responsible for androgen production. Androgen in this case is testosterone. Men don't have aromatase aromatase to turn testosterone into estrogen in the testicles. It has it in the brain, but not in the testicles. Whereas in the female, the ovary has a lot of aromatase, which turns the estrogen to testosterone, turns testosterone to estrogen. So the functionality, this whole process is working very similarly, but in the male, it has not varied. In other words, 24 hours a day, 7 days a week, this is happening. In a female, it's episodic, it's in a menstrual cycle. So there's cyclicity to the female. So let's talk about the trip. Let's talk about sperm getting to the ejaculate. Most times when I ask a couple, how long do you think it takes for sperm to go from the testicles to the ejaculate? They think about lovemaking, they say about 30 seconds or 5 seconds or 10 minutes, or if they're really young, maybe 2 hours. But the bottom line, they think of it in terms of minutes or tens of minutes or maybe a half an hour. Well, in reality, sperm that are produced today in the testicles take 3 months to reach the ejaculate. So sperm travel about 3 months en route to the ejaculate. So if a man comes in today and says he's not feeling well, and is that going to affect my sperm, doc? I'm going to say no, because the sperm were created 90 days ago. And so how were you feeling 90 days ago? That's going to tell you a little bit about your sperm, right? So this trip allows sperm that don't know how to swim to swim. That's basically what it does. It allows sperm that don't know how to swim to swim. It gets them ready, the acrosome, the cap of the sperm, to be able to penetrate the egg. So it takes about, oh my gosh, it takes about 3 months to get from this point to here. So my question to folks is, how long does it take for the sperm, when you ejaculate it in the vagina, to get to the egg? Somebody throw some guesses out there. Let's just maybe have a teeny break here. How long do you think it takes the sperm? Like it takes 3 months to get to here. How long do you think it takes the sperm to go from the ejaculate to the egg? So let's throw out some guesses and I'll drink some water while you guys are guessing. Throw out some guesses. Nobody. Come on. How long do you think it takes? 2 days. Okay, Robert, thank you. Keep guessing. 10 to 20 minutes. Okay, Brittany, keep guessing. 24 hours. Martiza, 24 hours. Luigi, 24 hours. Allison, 2 days. Okay, keep counting. I'll tell you when you're close. 3 days. Keep going. Let's see, 1 week. Okay. Go the other direction. The other direction. 14 days. Okay, go the other direction. Keep going the other direction. Keep going. It must be a slow internet today. Other direction. 5 days. Other direction. Keep going, Kayla. Keep going. Down, 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 down. Less than 10 minutes. Getting closer, Cindy. You're closer. You're closer. So close. I could. Nope. Further away. Further away. Further away. Further away. No, no, no. It takes 5 minutes. It takes 5 minutes for the sperm that's ejaculated in the vagina to reach the egg, to literally surround the egg. 5 minutes, okay? So this is why we have teenage pregnancies, because the couple will say, well, we pulled out and, I didn't ejaculate, or I barely ejaculated, and of course they're pregnant because it takes less than 5 minutes. So my question to you ladies is, why do your gynecologists ask you to keep your legs up for 20 minutes after sex? It's because they have a sense of humor. It doesn't help your fertility, but they think it's kind of funny thinking about you guys with your legs up for about 20 minutes thinking it's going to help. That's just a joke. That's just a joke. It doesn't help. It doesn't hurt. But yeah, 5 minutes is reasonable, Sylvania. Yeah, take 5 minutes. But the bottom line is it doesn't take long at all for sperm to reach the egg. All right, so the other part of the biology of reproduction, and I don't think you could see it, is this little black thing says 1 sperm, right? Everybody, if I ask the question, how many sperm does it take to fertilize an egg when a man ejaculates? Usually everybody will say 1. Does anybody want to guess what the actual number is? How many sperm do you think it takes to fertilize? How many sperm do you have to ejaculate right there in the vagina to fertilize an egg? Everybody says 1. It makes people feel better. This is really slow. 10 million. Okay. Higher. My internet must be slow. 1,000. Much higher. 2 million. Okay. So let me tell you, it takes 100 million sperm in the 370. Hi, Nicole. Perfect number. It takes 100 million sperm in the ejaculate to get 100,000 sperm inside the uterus. It takes 100,000 sperm in the uterus to get 4,000 wrapped around the egg to break the shell of the egg to allow 1 sperm in. So you need a lot more than 1 sperm to fertilize an egg. And that's why it's so critical when we do the semen analysis, when we look at concentration, that we're talking a very large amount of sperm are needed. So you need, that's where we'll get back to abstinence, you need to rest for 2 or 3 days from ejaculating to get the 100 million. And yes, Jamie, we need a lot of teamwork. That's what those 4,000 sperm do, is they break down the shell of the egg to allow 1 guy to slip in. That's what they do. But these numbers are astronomical. Astronomical. So let's talk about the causes of infertility. As I said before, 40% is the male, 40% is the female, 20% is both. So it's a 50-50 deal. We're talking about males today. What are some of the things we look at? Well, we look at the sperm shape, which is called morphology, motility, count, concentration, function, infections in the prostate, varicose veins called varicoceles, genetics. There's a lot of things that can go wrong. And what I decided, and I don't intend for you to even imagine this, but I'm going to tell you the topics here. This is just some partial list of all of the things that can go wrong on the male side that would affect fertility. Here we talked about abnormal sperm parameters, problems with intercourse, not being able to do it, erection issues, ejaculation disorders. Men who are on Lexapro can't ejaculate. Men with diabetes will ejaculate inside their bladder. So there could be ejaculatory disorders. There could be chromosomal abnormalities in the Y chromosome. These are called Y chromosome microdeletions. There are diseases of extra chromosomes that can significantly impact the development of gametes, of sperm. There could be deficiencies in testosterone production so that even though the guy is a 46XY, he looks like a girl, 46XX, because there's no receptor for testosterone, so they're incompletely virilized. They're not virilized. They can have developmental causes, meaning they only make Sertoli cells, so they have germ cell aplasia, so they don't have the germ cells, which are where the gametes are. A lot of times we have men who had their testicles cryptorchidism. When they were born, their testicles were stuck inside their body, and they had to pull down the testicles to prevent cancer, but they have permanent fertility issues. There could be genetic issues, toxin issues, radiation, trauma, viral issues, hormonal issues. A varicocele. What is a varicocele? It's a varicose vein of the testicles. It's a heater, H-E-A-T-E-R, of the testicles, and this can cause sperm production to dramatically fall because testicles inside the body can't make sperm. Testicles outside the body can make sperm. Even 1 degree difference can change whether or not your sperm are going to be capable of being created. So think of the testicles as tea bags, and you like in the hot tub. It's like taking the testicles like a tea bag, putting it into the hot tub and cooking the testicles. That's why we tell men stay out of the hot tub, is because even slight increases in temperature of the testicles will cause dramatic changes in sperm production motility and even a little bit of morphology. Hormonal causes. You can have a deficiency in the production of hormones, the LH hormone, the FSH hormone, both hormones. It could be inherited and it could be congenital. There can be mutations in the receptors. Testicular feminization means this is a male chromosome being, looks exactly like a female because it doesn't have any receptors for male hormones. So it looks exactly, because our default body of a human is a female. You need testosterone to look like a male. You could have anti-sperm antibodies, which is where your body is attacking itself. Men who's had vasectomies, when they get them fixed, they think, oh God, I have sperm now. But no, you have sperm that are being attacked by anti-sperm antibodies, which glom up the sperm so it can't travel. That 100 million can't get down to 100,000, can't get down to the 40,000 that's needed to break the shell of the egg. So even though you fixed your vasectomy, you may have 100% anti-sperm antibodies and still not be able, with sex, to fertilize an egg. You could have surgery, scrotal surgery. You could have trauma to the testicles that can shut off This is the interesting. This is called basal cell arrest. You could have sperm on Monday, and a man could have no sperm on Tuesday. It's called testicular arrest. It can happen like that. So a lot of couples will come in and say, oh, it's my fault, I'm the female because my husband has kids. No, your husband could have made kids when he was 16 or 18, but his sperm could have been shut off since he was 20 years old. And here's another thing, because this is a very honest and brutally honest conversation, 15% of all children are not the fathers. So a lot of times you'll have men who have no sperm at all say they were told they were the father of this or that child when they really couldn't be because they never made sperm in their lives. So again, as a reproductive endocrinologist, we have to deal with all these this reality of human diversity. You could have infection, mumps or orchitis. When you get mumps as a child, yes, Jessica, I'll be answering questions here in about 20 minutes. You can have mumps as a child, never affecting your fertility, but if you have mumps after age 14 and you're in puberty as a male and you get those super high temperatures, it can wipe out all the sperm production. Cystic fibrosis. These people have this gene, defect cystic fibrosis, and they're fine, or they have lung issues, but they never create the vas deferens, which is the plumbing between the testicle and the penis, or the seminal vesicle. So they have sperm in their testicle, they have no way for it to come out. So those folks need what's called a teaser. Pituitary disease, ejaculatory disorders, medications and drugs of abuse, marijuana, opiates, heroin, alcohol, tobacco, all significantly impact sperm production. Burns, if you have a burn on your testicle accidentally, if you have diabetes, cardiovascular disease, even severe depression and stress. A lot of military folks who go to war, their sperm production goes really down because, quite frankly, the stress hormones significantly impact the normal secretion of testosterone. And the list goes on and on and on. My point in showing you this list is not for you to memorize it. It's for you gentlemen to understand it ain't as simple as it seems to be. So men, you're 50% of the issue. So on the right here, I'm going to shift here. And on a female, before they're born, they have about 4 million eggs. But at birth, they're down to about 2 million. By the time they're 18, they're down to about maybe 400,000 eggs. And then they simply run out the rest of their lives until about age 51. They go through menopause or low ovarian reserve here. So that's the female. So they have a limited resource. It's a very precious resource. It's the egg. It's really important that we understand that because of this loss of eggs and it never replenishes, the females are desperate for time. Now, what about the guys? Well, on the guys, the sperm are made in the testicles. It starts at puberty. And you are making 1,000 sperm for every heartbeat. Every heartbeat, day or night, you're making 1,000 sperm per heartbeat. Your partner's losing 1,000 eggs a month, never come back. Every heartbeat, you're making 1,000 eggs. So I joke around with couples and say, if you want to make more sperm, just get the man's heartbeat up and you're going to get much, much, much more sperm. It's not true. Hello, La Medina. Jump over from Instagram, jump over to Facebook Live, and I'm doing a talk over on Facebook Live, so just jump over. So men are always making sperm every heartbeat, right? They require the same hormones that female to regulate that production, but the testicles and the sperm are exquisitely sensitive to the environment. They are the sentinels. They're the scouts. Did you ever wonder why it takes 90 days for the sperm produced today to get out, and it also takes 90 days for the woman's egg to be called into action to get out? During those 90 days, in caveman parlance, they were looking for a safe place to grow a family. So if a man goes somewhere and it has bad toxic area, well, he's not going to reproduce well, and you're not going to create a village there. So the man's sperm are exquisitely sensitive to the environment. And that's the whole idea about DNA fragmentation and the effects of toxins on sperm and marijuana and alcohol and all those other things. Sperm can be stored for decades, even longer, once you freeze it. And sperm function declines 50% between the ages of 20 and 40. So again, age actually affects the female, and it also affects the male. So all of these things play a role. So again, this is for the guys, so you have a better idea about your wives. What do you think the chances of getting your wife pregnant by intercourse alone based on her age at age 15? Most folks, if you want to guess, most folks say 100%. Because my mother told me, I kiss a girl at age 15, she's going to get pregnant, so don't kiss a girl. Don't mess around. It's going to happen dramatically. And most folks think, well, it's 100% at age 15, so maybe by age 45, it's a little bit less, maybe it's half. Maybe I have a 50% chance each month of getting pregnant. Well, here's the news. At age 15, a woman has a 20% chance of getting pregnant if there are no issues. In other words, there's no sperm issues, no egg issues, no uterus issues, no environmental issues. By 30, women have about a 10% chance of getting pregnant each month. By 40, a 3% chance. And by 45, they have less than a 1% chance of achieving a pregnancy with intercourse. So really, the chance of achieving a pregnancy is very, very low. And the reason for that is we're predators. And predators have a low chance of achieving a pregnancy, a very low chance of achieving a pregnancy because they're predators. And if you have too many predators, you have nothing to eat. What about men? Between the ages of 20 and 40, as I mentioned, there's about a 50% reduction in the impact of fertility on pregnancy rates, male fertility on pregnancy rates. So how they did this study, which I think is kind of fun, it was done in Hollywood, and it was they looked at men who, these are like film directors, it's called the Me Too thing now, but in the old days it wasn't. And so in the old days, these men would get married, have kids, they'd have, they may have some trouble, so they do semen analyses, and they look at their age, and then they were at 20 at the time. Now they're 40 years old, and they still marry a 20-year-old actress. Again, it's Hollywood. And what they found is that the ability to impregnate a woman declined, even though the semen analyses stayed the same. There was nothing that you could see that was different other than the fact of aging. So just like aging affects your hair color and affects your wrinkles, it absolutely affects sperm function. So 15 to 50% reduction. So when I talk about sperm transport, I think of it in military, in a sort of a military analogy. So the sperm are recruited, the raw recruits are in the testicles. They go through about 72 to 90 days of training to be able to swim to fertilize an egg. These raw recruits are transported to the front line, the cervix of the female, the mouth of the uterus, via the epididymis, seminal vesicle, urethra, and ejaculate. Then the sperm in the ejaculate have to battle through the cervical mucus. Think of it like the muddy pits of World War I or the trenches of World War II. They have to travel and go up and navigate. So only of that 100 million that are ejaculated, only about 100,000 get to the uterus. Now this is the tough part. Now it has to navigate this gigantic, how can I do it proportionally? It's like you landing on the shore of America in a ship and you have to find the egg in Kansas City. That's the size difference between, the difference there of the uterus where the egg is and the sperm where it lands. So it has to go through these fluids, get sifted up out the fallopian tube, and believe it or not, there is a pheromone that the side of the fallopian tube secretes where the egg is. So all of these sperm, you can see them swarming like bees up the fallopian tube. And these 4,000 now Navy SEALs that are left of the 96,000 that fellow soldiers who died trying to get them there, these 4,000 Navy SEAls get to the egg, and now this is where the big battle comes from. Because now this bachelor, like the show Bachelor, you can only get one chance to fertilize the egg, and once that egg enters the shell of the egg, once that sperm enters the shell of the egg, it shuts the door behind it. This is the sperm that's going to fertilize the egg. But it took 100 million troops to get that one guy to get in. So it's an absolutely marvelous, fantastic process. So now I'd like to talk a little bit about the testing. There's a couple of tests, dramatic tests. We'll talk about the sperm. There's two major ones, the semen analysis and the SDFA. In a semen analysis, we're testing how many sperm you have, how many swim, what do they look like, what portion of white blood cells, is there an infection? And of course, things that make a sperm strong is people think of strong as having certain parameters, approximately 15 to 20 million sperm per milliliter, about 40% of them swimmers, and I like to see about 14% of them normal shape. That's what makes a sperm strong. In sperm testing, though, and this is what I want to tell you, is that when we do a semen analysis, we're missing about 80% of the reason why sperm don't work. So just because you have a normal semen analysis does not mean that it functions. So what are some ways we can test the function? One is to look at the DNA fragmentation. The other is to look at whether or not you yourself have a Y chromosome defect. So what is that for? Yeah, 14% normal shape is what I like to see. That was the World Health Organization 4th edition of the semen analysis. The 5th edition said you only need 4%, less than 4%. That doesn't make sense to me. It just doesn't. Shape is morphology. So what is DNA fragmentation? Well, here's how to think about it. So if you do a semen analysis, you would expect, it says I'm normal, that you do an IUI and you're going to be successful, but we only find that 1 out of 5 men who has this normal semen analysis impregnates their wives. So what's going on? Well, it turns out that they may look good, but they may not function well. So the DNA fragmentation assay is a structural. What does the DNA look like? And of course, the DNA is what is responsible for the ability for the sperm to create a next generation. And the DNA is, like I said, the sentinel is definitely influenced by your lifestyle, alcohol, tobacco, marijuana, drugs. So what is it? So when you're looking at this is a DNA molecule, and so there's double-stranded DNA, single-stranded DNA. So you're looking for breaks in the DNA. If you do a DNA fragmentation test and it says you're normal, instead of 1 out of 5 folks getting pregnant, 3 out of 5 folks will get pregnant with an IUI. So now it doesn't eliminate all of them, but now instead of these prior 2 folks failing, we now are in a situation to better say, yeah, IUI will work for you. IUI will work for you. Nope, Silvana, you can't improve morphology. Morphology is driven by your DNA, your husband's DNA. So why do you use this test? To get to IVF faster. That's why you do the DNA fragmentation test, is to determine that IUIs are not going to be your best bet. It saves you money, it saves you time. So if you do this DNA fragmentation test and it says you need ICSI, you're much more likely to get pregnant. And you don't do the test, you try, you fail, then you do IVF, and then, yes, you do ICSI and then you get pregnant. So finding out about the DNA will help you decide which is the best test. What about the Zymot? Well, a Zymot is nothing more than a different mousetrap to determine whether or not the sperm have a DNA defect. And apparently it's called microfluidics. In other words, the fluids, the semen, and you got to have a significant amount of sperm. You got to have a volume of sperm. Like with this test, you can separate without doing a DNA fragmentation assay. You could do it with active live sperm because the DNA fragmentation assay will kill the sperm, so you don't want to use that. So this is a active test that's non-destructive to tell you whether or not you have higher levels of DNA fragmentation. And what it does is those with the lower level of DNA fragmentation get through this, and you're supposed to sift off the sperm that have less DNA problems. And yes, it does that. But what does it do it for? It really does it for IUIs. It does not really significantly alter the outcomes for IVF. And this is the big thing, because we're getting a lot of people asking about it, and it's expensive, it costs money. So yes, as you can see here on the right, you can separate out, this is your sample that's unprocessed, and this is going through Zymot. You can see the DNA fragmentation is high here. If you do what's called gradient centrifugation, which is what we do with all the sperm anyway, when we're doing an IUI, you can see we can lower the DNA fragmentation, and this thing lowers it a little bit more. But the bottom line is it does nothing in terms of IVF outcomes. Here's another study, no relationship with DNA fragmentation and getting pregnant or not. Another gigantic study, the results showed no association with DNA, statistical association with live births at all if you used DNA as a measure of whether or not there was DNA damage in the sperm that was used for ICSI, they found no relationship. There was a slight, although adjusted for bias, non-significant relationship with getting pregnant, but there was no relationship with a live birth. So the idea of doing Zymot, and that's somehow going to improve IVF outcomes is just not there. The best thing to do is go to the testicles, but again, even there, a lot of times it can help. In other words, doing a testicular biopsy to get the sperm if you have getting the sperm from the testicles can be better. What about Y chromosome microdeletion? Well, Y chromosome microdeletion is really telling you that the reason why your husband has sperm issues is because his Y chromosome has nicks on it. There are parts of the DNA, which is represented here, this is the Y chromosome, that have deficiencies or missing. And that can define, the type of sperm issue. Y chromosome microdeletion in this study is associated with decreased embryo quality. Your clinical pregnancy rates, early miscarriage rates are reduced. Fertilization rates are reduced, but they did not affect the outcomes. I said it backwards. So it didn't affect the good embryos, clinical pregnancy rates, miscarriage rates, live birth rates, etc. And it didn't affect whether you had a boy or a girl. So that's something we can do to tell you what the issue is, but not necessarily change the outcome. So again, that's not something we can do. What can we do with sperm? We can put it inside the egg. This is called intracytoplasmic sperm injection. And you can put the sperm actually inside the cytoplasm of the egg where the DNA is in our at CNY. 100% of our IVF, we do ICSI, unless people don't want us to. With ICSI, you have 20 to 25% more embryos made than if you do traditional IVF. So why you would want 20% fewer eggs, I don't know. Can you do sex sorting, sperm sorting for sex of a child? The answer is you can. It'll take a 51-50 ratio and maybe make it 70-30. It does not make it 100% Y chromosome sperm and 100% X chromosome sperm. They want to say it does that, but it actually does not do that. And it's only done in Mexico and in France, as far as I know. For the LGBTQ population, of course, we have sperm banks. And when you're looking at a sperm bank and you're trying to figure out who to pick out, always pick out sperm that have a younger male and has a proven paternity, because in case you want to come back for a sibling, you want to make sure sperm will be available. Can you split sperm? Say you have poor fertilization, and can you do 50% donor sperm, 50% husband sperm to see whether or not it's a sperm or an egg issue? Yes, you can. Homework is nothing more than having sex at home while your wife gets medicated. That's what homework is. If you have no sperm and you want to essentially have a child that is as close to you as possible genetically, yes, a dad, a brother can provide sperm. So your dad, your brother can absolutely provide sperm in that circumstance, or you can use a donor sperm, of course. I'm in the military and get deployed. What can I do? Well, the first thing I recommend for you women and men is get your eggs and sperm frozen and stored. The number one injury in IEDs in Afghanistan and in Iraq were testicular injuries. So get your sperm frozen prior to leaving the country. We don't live in the same place. The husband and wife live in two different places. Well, you can get the sperm frozen at any sperm bank and shipped to CNY, and we will be happy to take care of it. If you can't ejaculate, what can you do? Well, we can get sperm directly from the testicles, or they can do what's called electroejaculation. It's a vibrator that's placed in the anus, and it will actually stimulate erections and ejaculation. Same thing for paraplegics. If you're a paraplegic and you can't get ejaculation, we can do the same thing. That's done by urologists. I have a neurologic disease and I ejaculate into my bladder. What can I do? Diabetics sometimes have this. Well, we can actually have you urinate after ejaculation, and then we can take the sperm directly from the urine and use that to make a baby. I only get erections when I sleep, and now will I try to have intercourse? What can I do? Well, Viagra, Cialis, of course. In this particular case, it may need counseling because you have the neurologic system is intact, but the psychological system may be in, there may be some issue there. I really can't masturbate and you want a sperm sample, what can I do? Well, your wife can certainly help you collect the sample. Or we can get special condoms that allow us to collect the sperm. You can have intercourse. You wrap the condom, put it in a container, you bring it in, we can get the sperm from there. Can I bring a sperm sample from home? Absolutely, you can. If I don't live close by a place to get a semen analysis, what can you do? We actually now have remote semen analysis. We'll send you a home kit, and then you just collect it home and ship it from anywhere you are. It'll get to us, and we'll be able to do a semen analysis. How long can sperm be stored and still work? We think over 100 years. Certainly, we've had it for 50 years, and it's certainly been functional. Is fresh sperm better than frozen sperm for creating a pregnancy? Absolutely not. How many IUIs do I have to provide samples for each IUI cycle? We tend to just use one sample for each IUI cycle, and that allows you to just collect. What should I do if I've been told that I have cancer and must get treatment, which means it's going to knock off your sperm? Get your sperm frozen. Demand that you want to get your sperm frozen prior to the chemotherapy, radiation therapy, and all oncologists know this. They just don't think about it. They're thinking mainly about your life. It's our job to think about your sperm. What if I drip every time after I pee and I have to shake, shake, shake to stop, the drips from happening? Well, that tends to mean you have a prostatitis. And pyospermia means pus in the sperm. So this is another thing that you can easily treat with antibiotics. I feel like I got a stick up my butt, or it's painful when I ejaculate. What does that mean? It means that your prostate is enlarged. Your prostate is enlarged. So that means that it may be infected or it could be cancer. It needs to be seen by a urologist. If I use the pull-out method, can I get my partner pregnant? Absolutely, because believe it or not, before you ejaculate, the little secretions that are at the tip of the penis can be tens of millions of sperm, and they can get you pregnant. What about your occupation? I found this really not funny. So if you have a number one here, it means you're sort of the population in this group have normal fertility. This population are much more fertile. This population is much more infertile. And the funny thing is, physicians are at the top here of infertile, but healthcare employees are at the top of most fertile. I find that absolutely fascinating. But things like policemen, firemen, and then the smarter you are, or apparently the more school you have, the less fertile you are. So that's just something to take into consideration. I'm assuming you've already picked your partners, so you really can't use this. Is there certain positions that will get my partner pregnant quicker? Well, these are the positions that have been said that have slightly higher likelihood of, this is the doggy style, this is the reverse cowgirl, this is the side-by-side scissor, this is rear entry, this is the wheelbarrow, which I have no idea what that is. And then this is the missionary position. So apparently position may play a role, so you definitely should experiment. How often should you have sex to optimize pregnancy? Well, this is a really good question. So if you're tracking ovulation, if your wife is yes, and you have above average sperm count and a high sex drive, then every day is fine. However, if you're not tracking ovulation every other day, all month long, if you are tracking ovulation, but you don't have a very high sperm count, and I already said that men aren't having that every other day, seems to be probably the right number every other day or 2 or 3 times per week. And so I recommend 2 to 3 times per week, separated by 2 or 3 days to increase the volume of sperm. What about when you should have sex relative to ovulation? Well, if you have sex on ovulation, about 25% of the folks will conceive. If you have it the day before, again, another 25%. But if you have it too soon before, not so good. After, not so good. This is not actually accurate. It doesn't go down to 0. And then how long should it take you to impregnate your wife if she's 20 years old? Well, basically, 25% of folks will get pregnant the first month, 45% the second month. As you notice, fewer and fewer are getting pregnant. At about a year, 85% of folks should be getting pregnant. And it's only 10% more if they wait 3 years. So these 3 years are too long to wait. So we use 1 year. If you're not pregnant in a year, then that's defined as infertile. So I know I'm running out of time here, and I didn't put a lot of time for questions, but again, this was a requested talk. So here we go. Healthy body is a fertile body. So alcohol, tobacco, street drugs, hot tubs, no-nos. The lifestyle impacts fertility. So keeping in shape, not being obese, reducing your weight. By the way, exercise increases both growth hormone and testosterone. Things like smoking can increase your likelihood that your partner will have a miscarriage. You should test. You should know. Don't assume you have sperm just simply because you had sperm before, and don't assume that that kid was yours when you were 15 years old. Very simple treatments, really, IUI or IVF. Either put sperm inside the uterus or take the sperm and fertilize an egg with ICSI. The outcomes are dramatically affected and are different based on the severity of the male factor. And yes, we can use adjuncts like traditional Chinese medicine to help. Woof! So there you have it. All about males, and it's a lot. So let me take a sip. I have about 10 minutes here. Let's do some questions. Okay. My husband has a sperm count is low. What is the best treatment for him? Depends on how low it is. If it's moderately low, try IUIs. If it's severely low, do IVF with ICSI. At what age does sperm decline in quality? Starting at puberty, it declines until it gets very low. Since sperm take 90 days, when is the most optimal time to do acupuncture in the male? 90 days before. Start 90 days before. How do you know if you should do IUI or IVF? Based on the sperm parameters, if you have severe teratozoospermia, less than 4% normal shapes, you really need IVF. If you have less than 2 million sperm, you really need IVF. If you have less than 5% motility, you really need. Other than that, it's a judgment call based on the age of the female. Can a varicocele be treated without surgery? I would say not likely, but also I would also say that varicocelectomies only help if their varicocele is huge, unsightly, painful. If it's just a small one, it's not affecting your sperm as much as they say. This is so random, but does blue balls have any effect on the sperm? So Luigi, what you're really saying is if you don't have intercourse enough, yes, you can have necrospermia, which means the sperm start dying. So ejaculating once per week is certainly a reasonable amount, 2 times per week, especially if you want to be fertile. Should you be having sex often before going through IVF? No, not if you followed my logic. You need 3 to 5 days of abstinence to get a really nice sperm sample. But IVF and sex are not related. Will exercise negatively affect sperm since it heats up the body? It can. So, for example, professional bicyclists who wear those lycra shorts that push the testicles up against the body and overheats them, very low reproductive potential. So yes, if you overheat the testicles, absolutely, no matter what you're doing. How do I get a test for my Y gene? Well, Y chromosome microdeletion testing, ask for it. We'll send it to a genetics lab and we'll do it. How likely are we to conceive with a TISA versus sperm donor? Well, the same. The same. Yeah, in other words, if you get fresh sperm from your husband's testicle and you get fresh sperm from a sperm sample, it's fresh sperm. So it should be the same. There shouldn't be a difference. But again, it's based on the genetics. If your husband had 50 kids and then he became azospermic, and the sperm donor never had kids, again, that's going to have an impact. Will Clomid affect my low count? So Clomid causes your body to secrete Excess FSH, follicle stimulating hormone, which we now know is gamete stimulating hormone, which we now know improves both testosterone and sperm. So yes, are boxes or brief better to wear for men testicles to breathe? Well, the bottom line is keeping your testicles cool. Now, the tighty-whities, again, putting your testicles up against your body wall, which is what happens with briefs, will heat up the testicles. So they say the boxers, because they dangle and they're cooler and etc., probably is better. We did IVF last year, but failed. My wife has PCOS and I have a low sperm count. No one ever explained what happened to me at CNY. I'm not sure what that means. What happened to you? I don't know. There's never an explanation why you have a low sperm count. So I'm not sure there's anything to say other than an observation. Is no underwear better? Well, you know, come on, guys. You guys can figure that out. That's a matter of choice. The main thing is just keeping the testicles cool and also keeping the husband hydrated. That's critical. You must keep hydrated. If you have stinky yellow urine, you're dehydrated, which means you're heating up. My husband has one testicle and his count is real low. They suggested Clomid. Is that enough? Maybe, maybe not. Try it, see what happens. Have you heard of HLA matching causing implantation issues? I'm not sure how that HLA matching causing implantation issues. Yes, Jen, I've heard of that. I'm assuming you're talking about your husband and you mismatching. I have, but that's not been proven definitively. I believe I missed a scheduled call from you. How should I reschedule, Thaddeus? Just simply call and say, hey, listen, I missed the call, that 800 number, and I know Jessica will throw that out there for you. Yeah, just call up and say, listen, I missed my call. Can I get back online? What are the side effects of COVID when men take it? What? What is side? Oh, the vaccine? None that we know of. None that we know of. That there's not been any so far mechanism that looks at the vaccine and fertility in men or women for that matter. What do you think about Clomid versus anastrozole for MFI, male factor infertility, in particular DNA fragmentation? It will not affect DNA fragmentation. Clomid or anastrozole will affect the production of sperm. Tiffany, I don't know what your question was, sorry. DNA fragmentation is helped by lifestyle, acupuncture, Chinese herbs. I'm now really going down the road of getting my, especially my A-born members, to start using herbal medications for fertility, both men and women. Did I hear right that DNA fragmentation doesn't matter much with ICSI? Absolutely. The largest studies in the world, Monobungum, B-U-N-G-U-M, have done, and DNA fragmentation has no role in IVF, in ICSI. Can PE affect fertility? I'm not sure what PE is. Pulmonary embolism? I don't know. Can PE? I don't know what that is, Tiffany. I don't know what. Tell me what PE is, please, Tiffany. Are there remedies for sperm antibodies, Brittany? Well, you know, it's interesting. Some traditional Chinese medicine doctors think that there are some herbs. As far as we know, antibodies are antibodies and they're there for life. Is ICSI a part of IVF? Absolutely, at CNY, but in other institutions, they may charge up to $5,000 for it. It's included. What is the acupuncture for IVF called specifically? You go to a traditional Chinese, there's no such thing, there's no name for it. It's just a traditional Chinese medicine approach, and they'll diagnose what the issues are and treat you. How often should males ideally get acupuncture going into an IVF cycle, Jessica? Well, the bottom line is go in there and get a diagnosis or a differentiation of, premature ejaculation. Thank you, Tiffany. I'll get back to that. How often should males ideally get acupuncture? Again, that's going to be dependent upon the diagnosis. Premature ejaculation, can it affect fertility? Well, if you got to get sperm inside the vagina, and if you can't, then just do a semen. Just have do an insemination, and that'll take care of it. You know, that'll take care of it. The success rate for IVF with ICSI with 100% or near 100% affects sperm by with ICSI with 100. Oh, yeah, antisperm antibodies do not affect ICSI. That won't affect doing ICSI. What do you recommend for high DNA fragmentation of 50%? Well, in my mind, what's the cause of it? Do you have a recommended acupuncturist in Colorado Springs? Yes, of course. East Winds Acupuncture. They're, of course, she's my wife, but she and I did all the original research on acupuncture and IVF. And she is the founding member of the American Board of Oriental Reproductive Medicine. She and Dr. King, of course, are resources here. Christy, I'm confused. When we did Zyma with Dixie, almost all my eggs fertilized, but when T's is 0 sperm fertilized, we have a decent sperm parameters other than DNA fragmentation, just 28%. How does this play together? There is no answer for that, because just because something is related does not mean it's causative. So if you had done another teaser or another area of the testicles, that might have worked. If you hadn't done Zyma and done centrifugation, that might have worked. Or if you simply did another sample, because the DNA fragmentation is a function of your husband's lifestyle and a variety of other things. So getting a better lifestyle has more of an effect on all of this than the Zymod or even TISA in terms of outcomes. And I guess that's the main point of this, is, you know, that's really what I was hoping with this lecture is, and by the way, all of this is recorded. And so you can, I know I speak fast, but I've just had a gas doing all of this lecture for you all, and I hope it was helpful. I'm kind of running out of steam. What would be the best diet in your opinion for male factor infertility? Well, a Mediterranean diet, high seafood, fat, staying away from white products like rice and wheat, and high sugars. That's never good. You know, CBD, I'm like the worst person to talk about it. To me, that's not something that I recommend nor would recommend, because there's no data. For all of you, thank you so much, Christy. Oh, good, Ken. I'll see you first thing in the morning. I'll call you. Yes. Yes. Well, it's time. So thank you, thank you, thank you. This is Dr. Paul Magarelli, CNY Fertility, part of the CNY Fertility multiverse. Thanks, Dr. Kills, for creating CNY Fertility and creating these lives. Thank you, the global travel team. Thank you, my Colorado team. Thank you, all of you, for really making this exciting. As usual, next week will be a question and answer session, so just an hour of question and answers. And then my goal, of course, is to keep building this, build this. The more you know. Remember, these are all recorded. Thank you so much, Kelly. I appreciate it. I'm going to sign off and get some dinner. Thank you all, and be safe. Get your vaccine. I'm a very strong supporter of that, and you all be well. Thank you very much, folks. Bye-bye.